We certainly take note, as Director General Pirogov mentioned, of the plenary meeting of the World Health Assembly that called upon member states to take measures to protect the poorest and vulnerable groups from transplant tourism and the sale of tissues and organs, including the wider problem of international trafficking in human tissues and organs. This slide, and perhaps we could turn the lights down, but is very illustrative, and it is certainly one in which the voluntary altruism as an ethical principle that Professor Kaplan called upon is violated. It's quite evident there that these individuals have no choice about a circumstance of being an organ vendor. Next slide. The solicitation for transplant tourists has become culturally specific, as you see here, and that is no longer accepted. I should say in a very commending way about the government of Israel, they have now put into place a public policy that says if it is illegal to undergo transplantation outside of that country by having a bought organ donor, then the insurance companies of that country cannot support that transplantation being undertaken. That's a very important, commendable step to combat transplant tourism and organ trafficking. Next slide. The professional organizations have now taken note, as I mentioned earlier, of the World Health Assembly directive to do something about this problem.
Actions have been done and many efforts taken on a global level in the last years for trafficking in human beings. We have two major legal instruments. First, the UN protocol to prevent, suppress and punish trafficking in persons, especially women and men, supplementing the UN Convention on Transnational Organized Crime, and second, the Council of Europe Convention on Action Against Trafficking in Human Beings. Both are very comprehensive and they do not leave any major issues open, so that in this respect no legal action is needed. On the other side, the situation for trafficking in organs, tissues and cells is quite different. We do have several instruments dealing with that, but we are missing an international definition that is agreed upon globally. So therefore, we conclude that it would be necessary to find one single definition that is recognized worldwide, and this should be done on an international level with the involvement of all professionals. And an international legal instrument could be set up, which should be based on three pillars: prevention, protection and prosecution, and it should cover four main elements. First, a definition of trafficking in organs, tissues and cells. Secondly, measures to prevent this crime. Third, measures to protect and assist donors. And lastly, it should include criminal law measures to prosecute the traffickers, especially intermediaries, brokers and doctors and medical staff involved in such activities.
And I think the conclusions of the study are relatively clear. There are problems of definition. We have an international legislation. We have a legislation and definition available already covering the trafficking in human beings for the purpose of organ removal. But the joint study points out that there is a legal vacuum. Such legislation doesn't yet exist covering the trafficking of human beings. Trafficking in organs, tissues and cells. So the study is proposing that such a legal instrument should be developed, and the Council of Europe is of course going to consider this, how to take it forward.
The reason I think we were so strong on the ethics here, knowing that there are proposals around to change the system, talk about markets, talk about bringing trafficking above board, if you will, is that it seems to us that money for ports is still a situation that exploits the poor, that people do not have choices in nearly all parts of the world when they sell an organ. Data shows that they do not improve their situation post-sale. They do not work their way out of poverty, that there's an astonishing indifference worldwide to the interests of people who sell their organs. They're not given good follow-up care. The quality of organs diminishes when you have markets and sale, and that it violates medical ethics to be involved in practices where you harm people just so they can sell a body part. So despite being alert to pressures to rethink that foundation of voluntary altruism, this report does not go there. It reaffirms the principle that human dignity, basic fundamental rights require continuation of the ethical system that depends on voluntary altruism.